One of the main reasons why I believe so many people struggle with chronic back pain is not because people are not trying or because they're not putting in the effort to get better, but rather is because I believe people make very common and honest mistakes that prevent their bodies from healing correctly. So for today's video, I'll break down for you what I believe are the 5 most common but very critical mistakes that people make in terms of how they approach treatment for chronic back pain. So first off, my name is Dr. Kevin Mao. I am a physical therapist, and together with my wife Tui Lu, we own and operate To Balance and Body Restoration Physical Therapy Massage, which is a clinic located right here in Dublin, California. And every single day, we work with people who struggle with chronic lower back pain, and we help them find natural solutions to their pain without having to rely upon pills, injections, or unnecessary surgeries. And my goal with these videos is to share with you the tips and strategies from the very many lessons that we have learned over the past 14 years working with people who struggle with chronic back pain with the hopes that this information may be of use to others who may be in a similar situation. Now, there are some reasons why I believe people make these mistakes about how they treat their lower back pain. Maybe it's because you've just followed the wrong advice, even though the advice may have come from good intentions. This advice just may not have been what your body needs in order to get better. Maybe it's because you thought your pain would get better with one treatment approach, but instead your pain might be coming from somewhere else entirely different to what you thought originally, which might require a different approach. Or maybe it's because you just didn't know better, and maybe you just didn't realize at the time how serious your condition turned out to be, and now you might be scrambling in order to figure out what you need to do to get out of pain. But whatever the case may be, if you can learn to become at least aware of these mistakes and then obviously learn to avoid making them, while then learning how to make the right decisions in terms of treatment, this will not only ensure that you hopefully don't get stuck in the cycle of chronic back pain, but hopefully to also be able to fast track your healing so that you can start feeling better again, sometimes within just a matter of weeks of making the right adjustments. Now, with that said, let's get right into the list for today. All right, so the first mistake that I find that people make way too often is simply resting for too long. Now, one of the most effective ways to be able to get out of pain if you've just injured your back is to just simply rest, which means you do nothing, you find a comfortable position to lay in bed, and you just let your body heal and recover. Because of course our bodies do have this amazing ability to heal and regenerate as long as we don't get in our body's way. So for example, if you develop a cut on your skin, if you have fallen or twisted your ankle, then if you just leave it alone and just let your body do its thing, then at some point your body will eventually heal and recover. And if you are someone who maybe just threw your back out a couple of days ago, or maybe you pulled something in your back, lifting something too heavy, then it might make sense, at least initially, to just rest and let your body heal. And then hopefully within a couple of days, you'll get back to feeling normal again. However, if you are someone whose pain is more chronic, meaning that you've been dealing with pain for many months or many years, and if all you're doing for your lower back pain is to just rest and wait it out, then this is when you need to be careful, because if you rest for too long, then you run the risk of developing something that's even worse than pain itself, which is something called atrophy. So what is atrophy? So atrophy is a process that occurs when your body starts to weaken and starts to get very stiff due to a lack of stress and a lack of movement. So if you can imagine someone who has just broken their arm and had to have their arm put in a plaster cast for like 8 weeks, when the doctors take off that cast 8 weeks later, you'll start to notice that the arm has kind of shriveled up. The muscles got weaker, they got much smaller, the joints become a lot stiffer, and movement becomes much more difficult. And while the level of atrophy that happens when you have back pain might not be as extreme as an example of you breaking your arm, but the effect of atrophy is still absolutely there. And what makes it even more worrisome is that most people aren't aware of how stiff or how weak their bodies have truly become as a result of resting for too long. For example, we've been working with a woman who she had just turned 80 years old. She was struggling with very severe back pain for the past couple of years due to what was known as degenerative disc disease and arthritis. And her doctors told her that really wasn't much that she could do about her pain. And her symptoms were getting really serious. She was having a hard time just standing up for more than a minute. She could barely get around the house without a walker, even just to make it to her doctor's appointment. She was having a lot of difficulty. And the pain had gotten so bad that the doctors had no choice but to try to give her, multiple spinal injections just to help her manage her symptoms. And when she worked with us, when I asked her if there was anything else she was doing for her pain aside from the injections, she told me that she wasn't doing anything. One, because she thought that there was nothing that could be done, and also because that she told me that she just thought of that if she just kept on resting, that at some point the pain would go away, and it just never did. And this was really difficult for me to hear because I knew that the affective atrophy had probably started to set in because of how immobile she had been the past couple of years. Now, for our patient, even though resting and sitting and lying down may have been helpful in the short term because at least she wasn't in pain when she was resting, but what happened is every time she would try to stand up or go for a walk, her back would just tighten up like crazy to the point where she had no choice but to just kind of sit down after a minute of just trying to stand up. Now, the reason why she thought resting was the way to go is because she thought, or she was told, that her pain was due to inflammation, which is why they kept giving her anti inflammatory injections. And while she was hopeful that with enough rest, at some point the inflammation would go away, as it turns out, her pain was not coming from inflammation. Rather, her pain was actually coming from muscle spasms of her lower back muscles. And the reason why her muscles were in spasm was due to the fact that her back muscles were just simply so weak and lacked the physical strength just to hold her body upright. And once her muscles started to get fatigued, they would start to burn, they would start to ache, and her muscles would just tighten up to the point where those back muscles would just eventually give out and she had to sit down and rest. But despite all this, when we were able to help her get on a program to help her safely rebuild the strength in her back and also her legs, her back started to feel much better within just a matter of 4 weeks. And now, within a year of progressively strengthening her back and her legs, she's made so much progress to the point where she can walk without a walker, she can go to the store, she can go on some short walks. And while this may not seem like much, when you consider the fact that she was almost immobile and unable just to get out of her house a year before, her progress has been nothing short of amazing. And here's a very short clip of her now, demonstrating a deadlift exercise where she's actually lifting 10 pounds from the ground with excellent form and technique. Now, the point of all this is that I want you to understand is that rest should only be considered a short-term strategy, because if you rest for too long, then the effective atrophy may set in, and these are things that we want to help you avoid. Okay, so the second very common mistake that I find that people make is just simply treating the wrong problem. And I have to admit, as a clinician, this is one that I've been guilty of myself many times. Because as a physical therapist, my background is in using my knowledge and training of movement and biomechanics and neuroscience, and then applying this knowledge to help our patients heal by helping them do things like regain their strength or increase their mobility or their balance, and to do so in the safest ways possible. However, with any profession, whether it be physical therapy, chiropractic, or even spine surgery, we have to recognize that each profession brings very specific tools to the table that only solve very specific problems. For instance, physical therapy can solve things like strength problems or mobility problems. Surgeons can solve structural problems such as broken bones or bone cancer or badly herniated disc, for example. Chiropractors may be able to solve things like joint mobility or joint alignment problems. Some may even help you solve underlying dietary or nutritional problems. But the point I want to make is that physical therapy can't solve a broken spine or bone cancer. Spine surgery won't fix a nutritional deficit or a strength problem. And even if you try to match the proper solution, but if you put it on top of the wrong problem, then nothing's going to happen. And in some cases, the solution might actually make the problem worse. And this is one of the main points about back pain that I feel that people don't understand, is that not all back pain is created equally. And three people with the same symptoms might need three completely different paths of treatment depending on what their problems actually are. For example, I'll never forget this one woman that we worked with, who's having very severe back pain and sciatic nerve pain, pain shooting down her leg. She couldn't sit, she could barely bend forward, and she was just kind of in pain all the time. And while this is something that we have seen a lot and have a tremendous amount of experience in fixing, after about 8 sessions over 6 weeks for this patient, we honestly were not able to help her make a ton of progress. Even though she learned a lot and she felt a little stronger and found some exercises that helped her feel good, she was still in a ton of pain, and I honestly had no clue why she was actually still in pain. But it turns out 6 weeks later, after we parted ways, she had called me back just to let me know that her pain had gone away completely, seemingly overnight. And I asked her, what did she do? Because I wanted to know what she did to get out of pain. And then she told me that she didn't actually really do anything different. But then she opened up to me and told me that her husband had just recently found a job again and that he had been laid off about 6 months prior. And because he was the main breadwinner of the family and because they had two kids in college, she was just under this immense, enormous amount of stress, and it just started to affect her body in so many different ways. But once that enormous stressor in her life went away, so did her pain. And realized that her pain was coming from just immense psychological stress that was creating all this tightness and all this inflammation in her body. And once that huge stressor was gone, it was like literally taking a gorilla off of her back in terms of the amount of relief that she felt. And there are just so many other examples of the situation where people are trying all of these solutions to try to get better. Trying chiropractic or trying massage or trying physical therapy, taking medications, trying different supplements or having injections or even trying to do meditation. But you have to understand that these are all very different solutions for back pain that solve very specific problems. And before you jump right into doing a bunch of solutions, you have to learn to identify what the real problem is first before you try to solve it. This reminds me of a quote that Einstein once said. And Einstein said, I'm not sure if he actually said this, but this is the quote, that if he had an hour to solve a problem, then he would spend 55 minutes thinking about the problem itself and then 5 minutes thinking about the solution. And what this means is that spending time to critically think about which problem is before you try to solve it is one of the most important things that you can do before you start to jump right into the solutions that could lead you down the wrong path very quickly. But if you can identify what the problem actually is and then match the right solution on top of the right problem, then this is when amazing things can happen. And this is what really kind of triggers these really magic moments that really allows the body to start to get better. Okay, so the third mistake is that I see people make is that they rely only on taking medication to relieve their pain and symptoms. And again, I'm not someone that's against all medications, especially if you're in a ton of pain and really suffering, then, taking a couple pills to give you some relief and start feeling better in an hour or so, there's nothing really wrong with that, especially if your pain is due to something very minor or if it's going to be short term, then again, I don't think there's really anything wrong with taking a couple of pills every now and then. However, if your pain is more chronic and if you have been in pain for a while, and if you have been having to take pills for a couple of months or a couple of years, then this is when things can start to get dangerous. Because not only will the harmful side effects of the medicine start to build up, but it's also easier than you may realize to start to develop a dependency or even an addiction to some of these medications just to be able to function. We worked with a guy who was 60 years old. His back was in really rough shape. He spent years working in the field and construction. He played sports throughout his life, so he was very active, which meant he was also no stranger to his back and going out here and there. But when he was younger, all he used to do was just take a couple of Advils or just take a couple over-the-counter pills whenever his back would go out. And this strategy really worked for him when he was younger. But the problem was, as he got older and as the injuries started to accumulate, the pills just weren't working as well as they used to. Because not only was he having to take more medicine just to find the same amount of relief, but he also realized that he had to take them for way longer than he had to previously. And at some point when we had seen him, things had gotten so bad he was taking up to 12 Advil per day for over 3 months straight. And to make things worse, the pills weren't even helping him much at this point. He was very limited with his movement. He was in a lot of pain. Again, he could barely work. He could barely drive. But the problem was if he didn't take the Advils, then his pain would just intensify so badly to the point where he'd be forced to lay in bed all day long. Now, the reason why this was happening is because our patient was quite honestly just not doing the things that he was supposed to in order to allow his body to heal correctly. He never did much stretching. His diet wasn't great. He still stayed up late at night. He wasn't getting much rest, which meant that every time his back would go out, he just really wasn't doing the proper things he needed to recover properly. Instead, all he did was just continue to just rely upon pills, which ended up even masking his pain, giving his body this false sense of security that it was doing better than it actually was. And as his back started to deteriorate, he wasn't even aware of how bad his was because, again, his body was being masked by these pills. But however, once he started to work on fixing what needed to be fixed within his body, within just a couple of months, he was able to find substantial relief and was fortunately able to get all of his meds entirely. But the point I want to make is that none of this needed to happen, and he didn't need to allow it to get his body to get into the state that it was, because had he just known that pills are only supposed to be for short term and not supposed to be used for short term, or I'm sorry, for long term injuries, then none of this would ever have happened. Okay, so this brings us to the next very common mistake that people make, which is to only focus on treating the symptoms of lower back pain instead of treating the underlying root cause. And they find that this is by far probably the most common mistake because of how easy it is to fall into this trap. Because if you feel sharp pain in your lower back, then it makes sense to perform treatment on your lower back to try to relieve the symptoms right then and there. So, trying to get a massage or getting a chiropractic adjustment, doing some physical therapy stretches or exercises, or even putting pain patches on your back on the area where you feel the pain might make sense again, because these things can help you relieve your pain symptoms very, very quickly. However, again, if your pain is more chronic, and if every time you try one of these types of treatments, if your pain just comes back right after a day or so, then you must realize that this is a scenario in which the actual source of the pain might be coming from somewhere else besides your lower back. For example, it's very common that we'll see patients, for example, who sit a lot at work or have to drive a lot, or have a lot of poor posture because of how much sitting or how much work they have to do over their desk. And over time, even though they start to feel pain in the lower back, what they don't realize is that the reason why the lower back is hurting is because the lower back is simply overworking to overcompensate for the other problems that they may have developed in their hips or their upper back, for example. And because of the fact that they're spending all their time and energy or effort trying to treat and fix the problems of their lower back, not only does it mean that they're potentially creating even more stress and strain on their lower back, despite the fact that it's already under too much stress, but it also means that they are not focusing on fixing or addressing these other parts of the body that just need to have work done. And as these other parts of the body continue to be left untreated, the lower back pain can start to get worse, and oftentimes the person doesn't even know why. But the truth is, everything in the body is interconnected. And in order to heal correctly, you have to understand how to see the body as a whole, and then learn to fix on fixing what needs fixing instead of only doing things that may feel temporarily good at the time. And in all honesty, when you can learn how to do this and learn to fix the real underlying issues, it has been our experience that when we get this right and then start to perform the right treatments on the right areas, this is when we see really amazing things happen in terms of people experiencing significant reductions in their pain, and sometimes within just a matter of minutes. Now, figuring out the root cause can sometimes be very difficult because it takes a very thorough assessment to figure out what the real problem actually is. And then it requires you to have the knowledge to actually fix it. So to help, just for your information, we do have a free course that we have created that you can find right here on our channel, or you can find it on our website with the link in the description below, which will provide you detailed information about some of the most common underlying root causes of chronic back pain that we see almost every single day. And we will share with you, how to perform self-assessments to figure out which problems you have. And then we'll show you some very simple and detailed instructions on how to fix these problems through correct stretching and exercise strategies. Now, while these are by far not the only causes of lower back pain, these are ones that we see and have been able to get a tremendous amount of results for a lot of our clients. So feel free to check it out once you're done with this video. Okay, so the last mistake that I find that people make is that they just simply give up too soon. And again, I understand that if you're someone who's tried out everything to get better, if you've been in pain for years, it can just be absolutely exhausting and overwhelming. And sometimes it honestly is just easier just to throw in the towel and start to learn to live with your condition and just start to accept your pain. And as a clinician who works with people who struggles with this condition every single day, I can tell you some days that it is very frustrating. It's very difficult. It's not all sunshines and rainbows. And sometimes we do work with people who are very motivated. They put in the work to get better. And in some cases, it just doesn't work out. But despite all of this, we have also seen people, just countless amounts of examples of people who have been struggling for years, who have tried everything and haven't found relief. But if we can actually take the time and really figure out and identify the real root causes of their pain, And again, learn to match the right solution on top of the right problem. I promise you, this is when really amazing things can start to happen within your body, no matter what state your body is in, no matter what condition your body is in. We've worked with people who have had multiple back surgeries, for example, or people who have been stuck in wheelchairs for months just because of the fact that they're immobile or unable to stand up because of their pain. We've seen people who have struggled with pain for 10, 15, sometimes even 20 years of chronic back pain and are able to get back to being able to hike, do gardening, and be as active as they want to be, sometimes within under a year. People have been told that nothing could be done aside from surgery, and we've been able to help them avoid surgery and complete turn their symptoms around, sometimes within just a matter of a couple of weeks. In all honesty, I realized that it doesn't take endless amounts of treatment or therapy to be able to see some of these turnarounds. And instead, the body just needs a couple of the right treatments to fix the right problems in order to make progress. And sure, maybe you're not going to be doing backflips or start running marathons or be able to do things that you did when you were much younger, but sometimes all you need is just a spark of relief. And sometimes even just a 50% or even a 30% improvement to your pain and symptoms is all your body needs in order to recognize that it can actually get better. And if you can continue to just repeat this process over and over again and just continue to solve little problems within your body and then start to learn to make baby steps towards solving these issues, I promise you it is possible for anyone to at least make improvements to their situation, which can at least lead you down a path where you can start to feel better long term. No matter how old you are, no matter what shape you're in, or if you have, as long as you have a strong will and a desire to get better, if you're willing to put in the work and put in the effort, but most importantly, if you can put in the work and effort towards fixing the right things that your body needs, amazing things can truly happen. And that's why it's so important for you to not just give up and realize that the body does have an amazing ability and capacity to heal. It just sometimes takes time figuring out what your body actually needs to get better. So that's it for today's video. If you want to learn more or to get in touch with us, you can visit us at our website at www.balanceandbodyrestoration.com, and we hope to see you again next time. Take care and have a wonderful day.